Welcome to the easy series of prescription. So today we are going to talk about pharyngitis, tonsillitis from my book, The Resident Physician. I will tell you how do you give the different coverage for tonsillitis and pharyngitis. So first of all, we will talk about the clinical features: sore throat, fever, dysphagia, difficulty in breathing, generalized body ache, malaise, hoarseness or less voice, and the patient may having also odynophagia. You check do check vitals, and also when you check the throat, there will be congestion of tonsils and interior filler and posterior pharyngeal wall. There can be a large lymph node. Now on investigation, don't need to do any investigation, just do complete blood count is enough to look for total leukocyte count. Now the treatment, I divide it in different coverage to make it easy for the new doctors, that how can we prescribe a patient the treatment for pharyngitis and tonsillitis. So I will explain this whole scenario here. Now tonsillitis, infection of the tonsil, and pharyngitis. So you have to understand about the disease, and then you need to know that which coverage I need to do. So it is a bacterial infection, so I will give antibiotic, and their patient may can have allergy, so I will give also anti-allergic, and the patient will having pain and fever, so I have to give the coverage for that, and also PPI to reduce the acidity of stomach. So the antibiotic coverage, there are different varieties of antibiotic which we can give. The first antibiotic which we can try is amoxicillin. Amoxil 500 mg in TDS. This is the amoxil. But nowadays this antibiotic doesn't work because of the resistance. So we mostly didn't prescribe the amoxicillin. Another one is co-amoxiclav 625 mg, which is coming with the under brand name Calamox and Augmentin. We will give it in TDS for 5 days. Or we can also choose tablet azithromycin 500 mg, which is come under the brand name that is Azumex and Zetro. UDI for 6 days. But mostly we should avoid azithromycin because majority of people are now getting resistance to azithromycin. Another antibiotic which we can give, the scalithromycin, which is come under the name Claritic 500 mg BD for 5 days. So this is scalithromycin. We can also give cephadrine 500 mg, Velusip and Linvin BD for 5 days. And many of the area in many physicians also prescribe doxycycline, which is come under the brand name Vibramycin 100 mg BD for you can also give it for 7 days or 5 days, whatever. So just choose one antibiotic from it, and then this is the antibiotic coverage. Now we will give the anti-allergic coverage. If the patient having flu-like symptom or runny nose, all these, you should choose just one anti-allergic from this. Regix cetirizine 10 mg एक रोज़ाना रात को, लोराटाडीन which is come under the brand name Lorin NSA एक रोज़ाना रात को, Tide levocetirizine 5 mg एक रोज़ाना रात को. So just choose one anti-allergic from these if the patient having runny nose or flu-like symptom. Now for if the under anti-allergic, we can also say that if the patient is having nasal congestion, नाक बंद होता है उसका, सर और चेहरे में दर्द होता है like sinusitis feature, you should give fixofenadine which is come under the brand name Fixit एक रोज़ाना रात को, 1 UD at night. So this is fixofenadine which we can give for this nasal congestion. Or we can also prescribe fixofenadine plus pseudoephedrine which is come under the name Fixit D and Telfast D एक रोज़ाना रात को. So either you should give Fixit or you should give Fixit D, one of it. Okay. Now antipyretic and analgesic cover. The patient will having a fever and having generalized body ache pain. For that you should give flurbibuprofen 100 mg, which is come under the brand name NSAID, Inflammatex and Frobin BD for 5 days or 7 days. So here you can see this is flurbibuprofen and this is also flurbibuprofen, and it come 100 mg BD. Give any of it, same formula, just give NSAID or Inflammatex, whatever you want. So this will give the antipyretic coverage. Now another coverage for PPI, because the acidity, because of the GERDs or acidity, the many of the patient will having sore throat. So we will give omeprazole or esomeprazole, any PPI you can give. Esomeprazole or omeprazole, anyone you can give for 7 days. Now we will also advise the patient mouthwash, or if the patient having a money problem, you can just take 1 teaspoon of salt and mix it with lukewarm water and do gurgles with it at the night before sleep. And also tell the patient to avoid spicy and oily food and drink plenty of water. So this is how you just know about the disease, and just keep in mind that which coverage I have to give to this patient. By this way, it's very easy for you and how to prescribe the patient medication. Now in pregnancy, how do we treat tonsillitis and pharyngitis? Just give azithromycin, paracetamol and loratadine. So azithromycin 500 mg, UD for 6 days, Panadol, BD or TDS, and also as an anti-allergic you can give loratadine, Lorin NSA 10 mg, UD at night.